segment we will see the MMT for supination and pronation of forearm. As we know, biceps brachii and supinator plays the major role in the supination. So we will check in this segment the muscle power or MMT for biceps brachii and supinator. In this picture you can see the number 8 muscle is the biceps brachii muscle. Now in this slide we can see that number 6 muscle is the supinator muscles. Here the cadaver is in pronation, and in the left picture the supinator, here it is in ventral aspect of the forearm. Okay, in this segment we will talk about the forearm supination and pronation. So we will going to see the MMT for supination first. So what is supination? This is at pronation, this is called supination. The palm face upwards. This is. So which muscles play major roles? In the previous slide we saw that biceps brachii and supinator plays the major role in supination. So this is biceps brachii, and just below this cubital fossa we can palpate the supinator muscle. What is supinator muscle? Supinator muscle helps in the supination. Here is the insertion at radius. So lateral to the body we can palpate this. So I will instruct. So now talk about the patient position. Patient position will be half sitting. Now elbow is flexed 90 degree and the palm faces downwards. The palm faces downwards, that is starts from pronation to supination. So I will instruct the patient to just do this movement. Do this movement. Yes. So now the therapist position, he will give support to the elbow. He is give support to the elbow. For grade 3, we will going first for grade 3, because unless the patient perform the grade 3, he can't even perform grade 5 and 4. So for grade 3, it is full range of motion against the gravity without any resistance. So please do this movement. Yes, this is perfect supination at grade 3. Okay, once more repeat. Yes, thank you. Now we will go for grade 4 and grade 5. So for grade 4, we will grasp the patient arm like shaking hands. This shaking hands. We will shake hands to the patient like this and will give resistance to the patient. So we will give resistance to the patient and we will say to do this performance. Yes, it is minimal resistance. So what is grade 4? Against gravity, full range of motion with minimal resistance. Now we will perform grade 5 with maximum resistance against gravity, full range of motion. Please do the movement. Yes. You can see the supinator and the biceps contraction as well. Now we will go for grade 2. We know that grade 2 must be in eliminated plane, gravity eliminated plane. So we will place the hand and the shoulder must be at 45 to 90 degree. 45 to 90 degree. So this is at mid-prone position. So for supination, what we will do? He will do this movement towards his face. Towards his face. So please do the movement. Yes. 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 Thank you. Once again. Yes. Thank you. Now it is grade 2 gravity eliminated plane. So for supination, the full range of motion is 0 to 80 degree. Range is 0 to 80 degree, and for pronation outwards, towards outwards. This is for pronation. So it's gravity eliminated. That is grade 2. Now we will talk about grade 1. Grade 1 is flickering contraction. We will palpate the muscles, the supinator and the biceps brachii. We will palpate the muscles. We will feel the contraction. And now at grade 0, there is no movement, no contraction. So this is for supination. Now we will talk about the pronation. So pronator teres and pronator quadratus plays the major role to do the pronation. So here you can see in the left picture the highlighted one, the pronator teres, and in the right picture the 39, that is in the middle, is the pronator teres. In the left picture there is some muscles are left, that's why pronator teres is so prominent, whereas in the right picture they have all the muscles of flexor group of forearm. Now in this slide you can see the 17th, the underlying muscle is the pronator quadratus. You can palpate just above the wrist. You can see in the right picture as well the pronator quadratus. Now we will talk about the pronation. That is, this is called supination, this is called pronation. This is supination, this is pronation. So in the previous slide, you saw the muscles plays the major role for pronation. That is pronator teres and pronator quadratus. Where is the pronator teres? That is from ulnar bone. It started from this and go this. Pronator teres, like this. It's go. You have to palpate just below the cubital fossa in the middle. You can see the insertion at the radius bone. And pronator quadratus just 1 inch above the wrist. Just 1 inch above the wrist. You can palpate there. Now we will go for grade 3 first. So same position for the patient. Half sitting, elbow supported by the therapist. Elbow is flexed 90 degree. The range of motion is 0 to 80 degree. So now the movement starts from supination to pronation. Supination to pronation. The movement is supination to pronation. Like you have to do this. Okay. Now we go for grade 3. Full range of motion without any resistance against the gravity. Yes, please do this movement. Please do this movement. Yes, that is grade 3. Now we will give the same, the alligator grip. The same grip for this, with 2 fingers we support the wrist like this. You can see this. Yes. Now just, it is grade 4. It is grade 4. That is minimal resistance against the gravity, full range of motion. And now grade 5. Yes. It is full range of motion against the gravity with maximum resistance. Now for grade 2, what we will do? Same thing. Mid-prone position. This is called mid-prone position. This is called mid-prone position. For mid-prone position, now the palmar aspect will face towards me. Yes, go. Now, this. That is grade 2. That is grade 2. Gravity eliminated trend. Grade 2, full range of motion. Now, grade 1, you have to palpate. That is pronator teres. There's the muscle. You can palpate at the middle. It goes like this. It crosses like this. So you can feel it like this. You can see at the pictures what I shared in the slides. Like this. And now just 1 inch above the wrist you can feel the pronator quadratus. So grade 1, the flickering contraction of the muscles. And now pronator muscles are done. And so grade 0, no movement. So it is supination and pronation. Now in this segment we talk about the wrist flexion and wrist extension. In wrist flexion, flexor carpi radialis and flexor carpi ulnaris helps to do the wrist flexion. Range of motion is 0 to 80 degree. This middle one, that means the 4 is the flexor carpi radialis, and the 18 number muscle, the 19 number muscle is the flexor carpi ulnaris. So the middle one, flexor, that is 4, flexor carpi radialis, and the 19th one is flexor carpi ulnaris muscle. Now let's see the extensor group of muscles. So number 14 is the extensor carpi radialis longus. Just below it, 15 number muscle is the extensor carpi radialis brevis, and the number 6, that is at the left side, extensor carpi ulnaris muscles. So once more repeat, 14 and 15, that is extensor carpi radialis longus and extensor carpi radialis brevis, and number 6 muscle is the extensor carpi ulnaris, which helps in wrist extension. Now we will talk about the wrist flexion and wrist extension. Now we will use you can use a table. I use a tool here. This wrist flexion. The elbow is 90 degree flexed. Wrist flexion. This is wrist flexion. Yeah, no. This. Yes. Okay. This is wrist flexion. So the patient position, half sitting, use the table, 90 degree flexed elbow, and the hand is supination position. Now at grade 3, what we'll do? He will do this movement. This is grade 3. This is grade 3. For grade 4, minimum resistance I will give at there. So first of all, I have to support the wrist. I'm really sorry. First of all, I have to support the wrist. So I will support the wrist. So the therapist position is support the wrist and giving resistance to the phalanges. Now do. Yes. So this is grade 4. Maximum resistance. Yes. This is maximum resistance. So we will done grade 3, grade 4 and now we will do grade 1. Grade 2. That is gravity eliminated plane. That must be gravity eliminated plane. The wrist must be relaxed. The fingers must be relaxed. No, not will be tight. Yes. Do this. Do this. Yes. This is gravity eliminated. Yes. Do this. This is gravity eliminated. Yes. This is gravity eliminated. And it is grade 2. Gravity eliminated. Yes. It is grade 2. This is grade 2. Now for grade 1 we will palpate the muscles. So which muscles plays the major role? For wrist flexion, they are the flexor carpi radialis and flexor carpi ulnaris. So why you can find the flexor carpi radialis at the radial side, at the joint, at the wrist joint. You will find at the radial side. This you can find at this region for flexor carpi radialis and flexor carpi ulnaris. There you can find flexor carpi ulnaris. So we will just find the flexor carpi radialis and flexor carpi ulnaris. We will have to palpate for grade 1 and 0. There is no movement. Now, if we want to do the radial deviation and ulnar deviation, that is to test the separate flexor carpi radialis and flexor carpi ulnaris. So the same position, but for flexor carpi ulnaris, what we will do, just we have to instruct a patient like this. For flexor carpi ulnaris, this will be the flexion. This will be the flexion. Yes. Not. This will be the flexion for flexor carpi ulnaris. This muscle. You can see this muscle. And for flexor carpi ulnaris, this way. Yes. This is for flexor carpi ulnaris. This is for flexor carpi radialis. So the same thing we do at grade 3. There is no resistance. Please do the flexor carpi radialis. No. This region. Yes. At grade 3, it is grade 3. Minimum, I have to support the wrist. Yes. Now, what we'll do? At grade 4, minimum resistance. Yes. Maximum resistance, grade 5. Yes. Grade 1 have to palpate, and grade 0. The same thing, that is the vice versa for flexor carpi radialis. At grade 3, there will be flexion. This is the thing do for grade 3. Grade 4, yes, you have to support the wrist for every muscle, for every movement. Yes, maximum for grade 5. Now we will talk about the extension, wrist extension. So now the hand is pronation. So this is the extension. This is extension. So the same position, that is vice versa for the wrist flexion. So when we talk about wrist extension, there is extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris play the major role for wrist extension. So patient will flex 90 degree his elbow, his wrist must be supported, and he will do the extension. Yes, extend at grade 3. Now what we will do for grade 4, we will give a minimum resistance. Yes. Grade 5. Yes. Grade, so 3, 4, 5 are done. Grade 4, grade 2. Yes, do. Yes, I have to support. Yes. Thank you. Once again. Yes, thank you. So this is for grade 2, gravity eliminated plane and full range of motion. And for grade 1, you have to do where you can find the extensor radialis, that is along the radial side, at the radial. There you can find the extensor carpi ulnaris at the ulnar side, and extensor carpi ulnaris at the ulnar side, at this region, just this region, and extensor carpi radialis brevis and extensor carpi radialis longus at the radial side. So this is for wrist flexion and extension. So what we'll do here, forearm supination pronation and wrist flexion extension, and even for flexion for the flexor carpi ulnaris and flexor carpi ulnaris and flexor carpi radialis. Thank you. Now we will talk about the finger MP, that is metacarpophalangeal joint flexion and extension. So here we can see the 41 muscles are the lumbricals, which plays a major role in finger MP flexion. Now in this picture we can see the 38 and 39 are the palmar interossi, whereas 40 and 41 are the dorsal interossi, which also plays major role in finger MP flexion. Now in this picture we can also see that is 42 muscle at the flexor digitorum the tendon of the flexor digitorum profundus, and here the 24 number muscle is the flexor digitorum superficialis. 24 number muscle is the flexor digitorum superficialis, which helps in finger PIP DIP flexions. Both the muscles helps in finger PIP DIP flexion. Now in this picture we can see the extensor muscles of forearm and hand, that is deep layer, that is dorsal aspect. Here in this picture you can see the number 5 muscle is the extensor digitorum and the extensor digiti minimi, that is cut. So you can see in this picture, which helps in the finger extension, MP extension, that is metacarpophalangeal joint. So in this segment we will talk about the wrist MP joint flexion, that is metacarpophalangeal joint flexion. This movement is called finger MP joint flexion, metacarpophalangeal joint flexion, and this is extension. So the full range of motion for flexion is 0 to 90 degree, and for extension that is 0 to 20 degree, very less. Now for finger flexion, that is finger MP joint flexion, the muscles are palmar interossei, dorsal interossei, and the very important, the lumbricals. Now we will talk about the patient position. The forearm is in supination, the wrist is stabilized by the therapist, and the fingers are relaxed and extended properly. IP joint is flexed. IP joint is flexed. Now what we will do what the test is, I will instruct the patient to uncurl the thumb, uncurl his finger, and we will give resistance at grade 4 and grade 5 at the proximal interphalanges. Now for grade 3, he will do this movement. Yes, don't do tight koto na. This, done this. Yes, once again, yes. This is grade 3. For grade 4 and grade 5, we will give resistance at the phalanges. Yes, this is grade 4, very minimal resistance against the gravity, full range of motion. And now yes, do once more. Yes, this is very maximum, but he can do the full range of motion. This is grade 5. Now grade 2 is at eliminated plane. So what he will do, he will just, his position is mid prone, and he will do this. Yes, relaxed. Yes, relaxed. So this is grade 2, that is at gravity eliminated plane, full range of motion. And now he will perform, now we have to perform the grade 1 because there is no movement, but there is a flickering contraction of the lumbricals. Here the lumbricals, lumbrical 1, lumbrical 2, lumbrical 3, lumbrical 4. There are 4 in numbers. 1, 2, 3, 4. And you can hear there's the palmar interossei and dorsal interossei. You can palpate, you have to palpate this. And grade 0, no contraction. Now we will go for extension. What we'll do? Okay, before going to the extension, we go for the PIP and DIP flexion. So for PIP flexion and DIP flexion, okay, now we will go for PIP and DIP flexion. For PIP flexion, the muscles are flexor digitorum superficialis and flexor digitorum profundus. Where now we have to, what we'll do, we have to go for the same thing. Wrist must be stabilized by the therapist. The patient is in half sitting position, and the IP joint is flexed, and the fingers are stretched and relaxed. Now what we will do for the flexion, we have to hold the, we will do separately. This in this case we will have to separately do this. So what we'll do, yes, we have to stabilize this and hold the proximal phalanx for PIP. And now he will do the flexion. Do the flexion, this movement. Yes, I have to hold this. So for, yes, go. Yes, this is, yes, thank you. This is at grade 3. Now what we'll do, we give minimal pressure, resistance, sorry, yes, minimal pressure. And I will give more resistance, yes. This is grade 5. Maximum pressure we give, yes, that is grade 5. Minimal pressure we give, that is grade 4. So we're done, and this is grade 3, yes. So this is 3, 4, 5. So what we'll do, he will do at grade 2, do this gravity eliminated plane. Yes, he done this. Don't uncurl. He curl the wrist. Do yes. Thank you. So he done 2, grade 2, that is gravity eliminated. And grade 1 we have to palpate. However you can palpate the flexor digitorum superficialis. This go through this. You can palpate this here. Here you can palpate the superficialis and profundus. Flexor digitorum superficialis and flexor digitorum profundus. So this is grade 1. Now DIP, that is distal interphalangeal joint, we have to stabilize. You can do separately, one by one. Now we have to hold this muscle, this joint, that is middle interphalanges. Middle interphalanges. This is the proximal interphalanges, middle interphalanges, and this is the distal interphalanges. So we will hold this middle one, and he'll do the yes, absolutely. Now we'll give resistance, minimum resistance. This is grade 4, and we'll give more resistance. This is grade 5. Yes. So it is clear to everyone, I hope. That is, we'll give just hold it and please do. Yes, this is grade 3, minimum resistance. Go grade 4, maximum grade 5. This is DIP. Now the same thing you will do. We hold the distal phalanges. Yes. This is grade 2. And now grade 1 we have to palpate the muscle. The same muscles, that is flexor digitorum and flexor profundus, digitorum profundus, that is going through this, you have to palpate here at grade 1. So this is PIP and DIP flexion. Now we will talk about the extension for MP, that is metacarpophalangeal joint. The range of motion is 0 to 20 degree, and for the muscles are extensor digitorum, extensor indicis. So what we'll do, we will give support to, we have to support the wrist. We can hold this like this as well. So this is the movement, this is the movement, this is the movement. Yes. So what we'll do, we'll support and yes, please do. Yes, we can do as well also. Yes. So it is at grade 3. Now we'll give same thing to resistance to the proximal. This is proximal. We will give resistance to the proximal phalanges. Yes, this is very minimum resistance, that is grade 4. And for grade 5, do full. Yes, this is kind of hyperextension. So this is grade 5. Now for grade 2, he will flex he is at mid prone position, and what will do, he will extend. Yes, so it is at grade 2 at gravity eliminated plane. Yes, and for grade 1 we have to palpate extensor digitorum and extensor superficialis. That here we can palpate the extensor digitorum and extensor digitorum, extensor superficialis, and extensor indicis. So these are the for extension, that is 0 to 20 degree. So we done the extension for MP joint for fingers. Thank you.